With Bexar County Judge Nelson Wolff. We're joined tonight by Dr. COLLEEN Bridger, and this is our COVID-19 update for the San Antonio community. Tonight we're reporting 133 new cases of COVID-19, which brings our total to 202,849, with the 7-day rolling average now at 168. Unfortunately, today we have 2 new deaths to report tonight from COVID-19. We've now lost a total of 3,073 of our neighbors, friends, and family members to COVID. And so again, please remember that each one of these numbers, an illness or death, is a loved one who is missed and who we're grieving over, so please keep their families in your prayers this evening. We are seeing more improvements in our hospitals continue, so tonight we're reporting 182 patients with COVID-19 in local hospitals. That continues the downward trend. There are 29 new admissions in the last 24 hours, 72 patients in the ICU, and 40 are on ventilators. Again, the numbers are continuing to move in the right direction, and our vaccine numbers continue to go up, but we are not there yet, so please do not let your guard down as our community continues to get vaccines out. It is Tuesday, and we would normally review our school indicators today. The Centers for Disease Control and Prevention is now providing schools, including those in Bexar County, however, with the tools, indicators, and other guidance to support open and safe schools while still recognizing that COVID-19 presents an ongoing public health threat. With that said, effective today, March 23, 2021, all health directives issued by the Bexar County Public Health Authority related to school systems are now withdrawn, and we will no longer be compiling or reporting our own school data indicators, instead of pointing to that very good CDC guidance that is made available every day. And that will be consistent across the board. And quickly on vaccines now, as of yesterday in Bexar County, we have 421,411 people who have received their first dose, and a full 233,463 people who are fully vaccinated in our community. So let's continue to wear our masks and social distance as we work to get more people vaccinated. Briefly, on with regard to the Texas Department of State Health Services announcement today, all adults will be eligible to receive a COVID-19 vaccine starting next Monday, March 29th. The state has also directed vaccine providers to prioritize people who are 80 years or older when scheduling appointments and accommodate anyone in that age group who presents for vaccination, whether or not they have an appointment, by immediately moving them to the front of the line. This will ensure vaccination of anyone 80 and up to receive access as quickly as possible, which is something that we all need to protect the most vulnerable among us. So starting on Monday, the Alamo Dome encourages those who are 80 and over to visit the Alamo Dome Monday through Saturday in the afternoon to receive their vaccines. No appointment will be required for those 80 years of age or over. Let me turn it now to Judge Wolff.
Yeah, that's March 29th, Monday, I guess, that starts. I know out at University Hospital this week we're doing teachers and all school personnel. It's probably going to run about 3,000 or so a day. And we think we'll be through with all of it by Monday. It's possible we might still have some to do Monday, but we'll be gearing up and kind of getting our notice in place by the end of the week about how we will handle it. Obviously, we will be taking the senior adults that are 80, or we may even drop to 75, somewhere in that range, and giving them priority. And then we'll have to see how we fold in everything else and what how many vaccines we have to be able to give. So we'll be getting geared up for it and have some announcement later on this week about how we'll handle it.
Thank you, Judge. Yeah, a lot of changes happening in the vaccine administration process nationally, and we'll keep you apprised as how that moves into our community. And, of course, we still want more vaccines to go along with it. I do want to remind you, if you're struggling to pay rent or mortgage through this pandemic, there is help available for you. Our Emergency Housing Assistance Program is taking applications, and you can get more information by calling 311. Also, if you're out of work without an income and have been affected by this pandemic in that way, we do have a training program available for you, and where you can train for jobs that are available in our community today to be conducted safely, and you will also receive a stipend while you train to make ends meet. You can get more information by calling 311 or going to enroll at 210-224-HELP. And also, if you want to sign up for that text alert to know exactly when appointments become available for the vaccine, you can text vaccine or vacuna to 55000. And as always, you can get the latest on COVID-19 by texting COSAGOV to 55000 or by going to the website covid19.sanantonio.gov. Please remember, we are getting there. We have to get there together. Continue to mask up, practice social distancing and proper hygiene. Do it for yourself, do it for your family, and do it for San Antonio. Dr. Bridger, myself, and the judge are available for questions.
I would like to start off with just the border crisis. Is there an update from the city or the county about any used facilities? Judge, we're hearing some talks with the Freeman possible.
Yeah, we've been in discussions. I've talked with representatives of United States Health System as well as FEMA the last couple of days. We talked just a little earlier today, and no agreements been reached yet. But we do have facilities there. They're climate controlled. They're large. But we're talking about, how will we handle security, who would be the food provider, who will actually be managing the place. It'd be pretty much our job to, if we do it, to coordinate with them and to make the space available, but no agreement's been reached yet. We're just now talking about a possible contract if indeed that moves forward.
What would that look like? Would you support the Freeman being used, and what makes it an ideal facility?
Yeah, well, I would certainly support it. Look, we're dealing with children. Everybody can have their own opinions about what they think about immigration and who should be allowed in the country, who should not be. But we're dealing with young children, 16 years and younger. I understand some of them as young as 4, 5, or 6, 7 years old. And so it's a humanitarian effort. It's not a permanent solution. I think that we talk somewhere like up to about 60 days. And the fact that we have a large facility makes it a bit easier in the fact that it's climate controlled. So, but I don't know yet whether it's going to work out or not, and it's in the discussions right now.
Judge Wolff, if it is approved and this is something you all move forward with, how soon could we possibly see children at the Freeman?
I think if something happened, it would probably be within the next week or so, in the next week.
And do we know, I know it's all preliminary discussions right now, how many we could see?
That I don't know either. And I don't know the current situation on the border in terms of how many children they have and what other areas are they possibly looking at. There was some discussion brought up in the about Lackland base also. I don't know anything about that. All I know is about what the discussions we're talking with them about.
Mayor, has the city had any contact with HHS or DOD about the use of Lackland for migrants?
No direct contact from the federal government on the use of those bases. Obviously, that's federal jurisdiction. We did get word late day that Health and Human Services had made outreach to the Defense Secretary inquiring about the use of potentially use of Joint Base San Antonio. They've also made inquiries about other bases like Fort Bliss. My understanding is that they're still going through a vetting process, but we haven't gotten any additional information from that.
The talks on the county side, Mayor, would you all provide any assistance in helping them from the city standpoint?
Look, what's happening on the border, as we've seen before, is just an incredible human tragedy. And so my hope is that what happens going forward is treated with the utmost compassion and care. And obviously, if the county requested assistance from the city, we would be providing that.
Dr. Bridger, can you talk to us about what the process will be, your understanding at the state level of how people can register for the vaccine starting next Monday?
The state sent out a press release that did talk about registering in some locations. We didn't understand what that meant. We called them, and apparently there are a number of jurisdictions that do not have the ability to make appointments for people to be vaccinated. They've been relying on drive-through events. They haven't been scheduling appointments for individuals. And so that is what that press release was referencing. So we do not need that. All of the mass vaccination sites and all of the private vaccination sites have the ability to make appointments.
Is there any effort on behalf of the city and the county to coordinate with all those agencies right now to get one central location where people can register? Because as you can imagine, everybody that wants one is going to try to get one on Monday.
It is going to be a continuation of the angst and anxiety associated with being eligible to be vaccinated but not being able to get an appointment as quickly as a person would prefer. What I don't think people fully understand is that there are dozens and dozens of providers who receive the COVID-19 vaccine throughout Bexar County. We received over 65,000 doses last week. And so trying to get, 30, 40, 50 different people to all agree on a registry has proven to be very difficult, and basically we haven't been successful up to now. The number of providers will continue to increase, and so that complexity will continue to grow. The city receives about 10,000 doses a week of that 65,000. So even if the city independently created a registry, it would only represent those 10,000 out of the 65,000, and that 65,000 is growing every week. So, I have heard, I understand people's angst and frustration at not being able to just go one place one time and put their name on a list. But the other thing I will say, and this is a plea for those of you who are able to get appointments, we are seeing our no-show rate across the city at all of the mass vaccination sites grow. So a couple of weeks ago, it was 5%, then 10%. Last week, there was a day we had a 20% no-show rate. If you are fortunate enough to get a COVID-19 vaccine appointment, please keep that appointment. Please come for that appointment, because it's only exacerbating the unavailability for other people.
Any idea what that no-show rate is due to? Are people getting it somewhere else and registering in multiple places?
I think it's a combination of spring break and people forgetting or choosing not to come, and people, happening to get it someplace else. So, it's a number of different factors. With all things COVID, there is never a simple answer. But I think if people have an appointment, if they could keep that appointment, that will be very helpful.
What's the first step that people should do as on Monday, whoever doesn't have one yet and wants to get their shot? Where should they turn to?
So my request would be that if you are a young, healthy individual, please wait another month or so and let people, there are still a number of people who are 50 and up who have not yet been vaccinated. So if you're a healthy young individual and can wait a month or so, please do that.
I think, Colleen, that's been the problem right from the very start. We had healthcare workers, we hadn't even finished that, and hadn't finished first responders, and they say, okay, anybody over 65 and older can come. We haven't finished that either, and now we're saying everybody can come. So it's making it pretty complicated, pretty difficult.
But again, if you can hold off, please hold off. If you can't, like I said, there are dozens and dozens of providers throughout the city who are providing COVID-19 vaccinations. CVS's, Walgreens, HEB, all of those pharmacies are providing COVID-19 vaccine. Look for those and let the more vulnerable population have access to the 4 mass vaccination sites.
Will the expansion in eligibility lead to changes in the mass vaccination sites to deal with the larger group?
So on one hand, the answer is no, because while the state did drop all eligibility requirements, there was not an increase in the amount of vaccine being shipped to Bexar County as a result. So we're going to have to keep doing what we've been doing in order to vaccinate as many people as we possibly can every day. On the other hand, we are taking specific steps to give priority to people who are age 50 and up. So, for example, the mayor mentioned people over 80 do not need an appointment. They just show up at the Alamo Dome. They will be given a vaccination. Our community health workers are only scheduling appointments for people who are 50 and up. So we're taking a number of steps to encourage people who are eligible this week to be able to be vaccinated. One last thing we're doing is tomorrow there will be another text alert letting people know that there will be another 3 weeks of appointments opened up at the Alamo Dome exclusively for people who are age 50 and up and people 16 and up with underlying health conditions.
Are you considering establishing more vaccination sites?
We don't have any more. So the mass vaccination sites, there are 4. The amount of vaccine that we get is not increasing. So it doesn't make any sense to open another mass vaccination site. The federal government is increasing its weekly shipments to private providers throughout the county. And so that will continue to increase. And that's how a number of people are going to have access to the vaccine, is through their private provider or their pharmacy.
How much advance notice did you get prior to today's announcement that vaccine eligibility would open up?
We learned about it at the same time as the media.
What are your thoughts on that?
It's been par for the course. I'm worrying about things I can control.
For the mayor and judge, could you offer your thoughts on the opening up of the vaccine eligibility?
Can you repeat that?
Sure. Can you discuss your feelings about the expanded eligibility pool to all adults?
I mean, I think it's great that everyone is eligible. I just hope that that's matched with an increase in supply. Hopefully the state knows it's coming and so has acted accordingly. But as we know, the supply-demand imbalance has been our main challenge since this vaccination process started.
Yeah, we could do more mass sites if we had the vaccines to do it. I'm afraid what's going to happen Monday, everybody's going to be calling for an appointment and everybody's going to get mad again. And so unless we have more vaccines and more sites, it's going to be hard to handle everybody.
Dr. Richard, so my understanding is that private providers will be able to give the vaccine to anyone they want, but those that go through the city, the city will prioritize those over 50.
So Thursday we're opening up appointments for the next 3 weeks. What that means is for the next month, appointments at the Alamo Dome will be exclusively for individuals who meet the current criteria, so the 50 plus or an underlying health condition. Anybody who happens to get an appointment and shows up at the Alamo Dome will be served because that is what the state has decided.
Judge, going back to Freeman really quickly, when can we expect a decision?
In the next 2 or 3 days, some decision should be made with respect whether we're going to do it out there or not. It would be my guess.
All right, Metro Health, are you all involved, or Dr. Bridge, are you all involved in this process? Just making sure, if this were to happen, protocols would be followed.
I get, well, probably once the decision has been made, we'll be pulled into the loop.
Thank you. That's all we have tonight.